Just tell me when. Hey guys, this is Mike again from the Recovery Lab. We had an interesting opportunity here to show you kind of what we do on a day-to-day basis here. So this is one of our athletes, Vaughn, who unfortunately, like many athletes, while playing their sport, runs into certain injury issues. And in this specific example, it's a really common problem that we see here a lot, especially in the athletic training world, strength and conditioning world. And so while Vaughn is running down to first base, he stretched for that base to beat the throw and pop. Hamstring strain pull, was unable to finish the game. Obviously has significant amount of pain in this area. This happened on Saturday. It's now Monday. So this was about, 36 to 48 hours ago this injury was sustained. So we wanted to take this opportunity to kind of clear up any kind of myths and, misnomers out there about the proper way to deal with one of these types of injuries. Okay, so right now we're talking about an acute soft tissue injury. And what I mean by acute is that this happened in one instance. Bang, he felt that pop. That's where the injury took place. It wasn't something that was building up over a long period of time. So there are different ways to kind of go about handling an acute injury versus a chronic injury, which we can kind of go over in a video later on. So for this specific example, your body's going to do two things to kind of deal with this acute injury. The first thing is it's going to go into some muscle spasm, okay? So this is that tightness that you feel immediately after this soft tissue injury happens. So what I want you guys to kind of imagine is that within his hamstring, right, what a strain really is there's three grades of strain, right? Grade 1 is, overstretched, slightly overstretched muscle fibers, right? Stage 2 or grade 2 is when you have partial tearing or partial thickness tearing. So some of these fibers have torn, but it's not a complete tear, which is a grade 3 strain. Okay, that's a complete rupture. So I evaluated Vaughn just before we got on with you guys on Periscope, and I evaluated him at about a grade 1+ to grade 2. So this is something where he does have some partial tearing, but it's not a complete thickness tear. I can feel a palpable divot when I feel his hamstring, especially at this more proximal end, which is a little bit higher up, closer to his glute and his hips up here. So the first thing you want to understand is that muscle, everything around that area is going to go into spasm. Everything's going to try to tighten it down. Your body is trying to protect itself from any further damage. Okay, that's the first thing your body does. The second thing your body does is your nervous system will actually start to switch off some of the muscles surrounding this area. Switching off might be kind of a bad term. We use the term inhibit a lot, which means that the muscles are working, they're in class, they're just really not participating as much as they should. So these are two mechanisms that your body is using for self-defense. So if we understand that, we can kind of help and aid this healing process along, which is really what my job as an athletic trainer is to do, right? So again, like we talked about in our last video, in terms of icing, really icing, the window is 24 hours and then stop. So, this happened a couple of days ago, so I'm not going to continue to ice this hamstring. He's in the inflammatory phase of the healing process. I'm going to continue to allow that to happen. Okay, so what we just finished doing was a heat pack, a moist heat pack from our hydrocollator, and a microcurrent treatment. Now, microcurrent is one of the older stem currents that's out there, but the great thing about microcurrent is that it's subsensory, meaning that your body doesn't really feel it. And the second thing it does is it kind of mimics the bioelectricity that your body naturally produces. So think about microcurrent as like a battery recharge for the cells, right? I'm giving the cells energy to carry on their normal processes of getting rid of metabolic waste, repairing, right? So I'm trying to stimulate that repair mode, in his body. Okay, so we did a 20-minute microcurrent treatment at a moderate frequency, about 1 hertz, okay? 20 minutes with the heat pack just to kind of create some blood flow, let that microcurrent do its thing. So next what I'm going to do is I'm going to do some very light soft tissue work. This is light sports massage, or effleurage if you want to use the Swedish name for it. But what we're going to do is just some light strokes here to kind of create a little bit of blood flow in this area. Okay, again, this injury just happened, so I'm not going to be pushing super deep. I'm maintaining contact with the athlete or with the client, and I'm just kind of working and assessing and feeling that tissue quality as I go. You know, and like I said before, I can feel kind of this little palpable divot at his high hamstring. So while I'm getting over that area, I'm just giving it a little bit of release off that pressure. I'm not going to be pushing too hard. Again, I also have his knee here, just something I wanted to point out, in a flexed position, right? So what I'm doing is I'm unloading that hamstring, okay? So a lot of people, they feel that tightness when it first happens, and the first response is to start bending over and stretching your hamstring because it feels tight. Don't do that. Please, don't do that. You get a soft tissue injury, the last thing you want to do is start stretching it out, because really what you're doing is just making it worse. Okay, so for Vaughn here, I told him 2 to 5 days, no stretching, okay? He can stretch other stuff, you know, if that's part of his plan, but for the most part, we're not stretching this hamstring because we want to let those fibers heal, okay? Again, inflammatory phase, 2 to 3 days. Repair phase is really 3 days to up to 10 or even 2 weeks, okay? So in that end of inflammation, beginning of repair phase, I want these fibers to kind of heal up. I want that scar tissue to lay down. I don't want to start cranking on it yet, because then I'm just kind of exacerbating that same cycle over and over again. So he's not going to stretch it for probably the rest of this week, right? Today's Monday, so maybe Friday, depending on how he's feeling, I may, you know, start to introduce some light stretching again. But really, that's a subjective thing, okay, guys? So, you know, clinicians out there, use your judgment, okay? You got to reevaluate this type of injury every day and see what you can do, okay? I like to be aggressive to a point, right? There's that line between aggressive and just stupid of what you're going to try to push this athlete to do. So I like to kind of flirt with that line, but progress him as tolerated. If he's feeling it, then stop, okay? So we're trying to do, you know, again, exercise-wise, he's going to be fairly limited for the next few days, just so we can kind of reassess how he's feeling, okay? So like I said before, maybe, you know, 5 minutes or so of just kind of this effleurage, maintaining contact with the client. Okay, and then I'll start to do maybe a little bit of light ART work, some active release where I'll flex that knee, and really I'm just kind of letting that hamstring glide under my hands. Again, I'm not using a whole lot of pressure. I would say I'm using mild to moderate pressure right now. And I'm easing up right as I get to that divot, right? Because I can feel that. I can feel where that injury site is. I'm trying to stimulate healing and blood flow in that area. I'm not trying to reform scar tissue right now. That deeper kind of aggressive tissue work is something we're going to do probably a little bit later in the healing process. Okay, again, I like to, you know, while we're doing this, I can explain a little bit more about the setup I have here. Again, his knee is flexed. I drape him with a towel. I tuck it under his clothes here. That's just more for patient comfort, patient privacy. I like to use a dual-purpose massage cream. Biotone is kind of the brand of choice here. This stuff is great. It has arnica and ivy in it, which helps with bruising, but it doesn't super absorb into the skin. It leaves enough drag so that I can actually do some of my myofascial release techniques, some of my active release techniques. So it gives me that glide I need, so I'm not irritating his skin, but at the same time, I still get enough drag. It's not super oily. It absorbs very, very slow, so a little bit goes a long way. Definitely recommend it on that. Vaughn, how you feeling here, bud?
You good?
You okay? I'm not killing you right now? Again, just continually asking your patient, reassuring that what you're doing isn't aggravating or bothering him. So the other thing I wanted to bring up about hamstring injuries is, you know, the progression from this stage, which is very acute, injury just happened a couple of days ago, to what we're looking for at the end of the day, right? So over the next couple of weeks, obviously his pain will go down. He's not going to be feeling this injury while he's walking around. But when he's in the gym, you know, obviously we want to continue to train him around this area, around this injury, but also kind of see a consistent progression from where he needs to be. Excuse me. So a lot of times what's missed in these hamstring rehabs is that eccentric phase, right? That eccentric control of the hamstring. So again, keep in mind, guys, this hamstring is a hip extensor and it's also a knee flexor, right? So it has two actions that it has to do, right? So where you see guys start to have chronic hamstring injuries that occur more than once, more than twice, is they're missing that timing aspect of integrating this double action of hip extension and knee flexion back into their sport, right? So, you know, again, we're going to work on probably concentric, just muscle activation techniques, right? Just getting his nervous system to fire this again and control it. And then we're going to progress into obviously weight bearing, load bearing, and then really focusing on our eccentric phases before we integrate this into running patterns, skipping patterns, even some of our heavier lifting, deadlift, squat patterns as well. So we'll do some light isolation work with him maybe in a couple of weeks, over the next couple of weeks, but I'm not going to really deadlift him heavy. I might do a hip thrust or a glute bridge, a similar pattern that we're working on, obviously the software end of things, but we're not going to be really crushing or isolating this hamstring too much. Okay, so again, this is our first session with Vaughn since the injury happened. So now what I'm going to do is just look to, again, create an optimal healing environment. So I did some tissue work. I created a little bit of blood flow. You know, now I want to try to set him up for success, you know, in the next few days. So one of the things I would really like to use, a nice tool that we have here in the recovery lab, is our use of Rock Tape. Okay, Rock Tape is a brand of kinesio tape. You can check them out, www.rocktape.com. It's a very, very high quality kinesio tape. You know, not like the KT tape you get in like maybe your local drugstore that maybe falls off after like a couple of hours. This stuff, you know, I've had it on athletes for as long as a week. Okay, so again, I get asked a lot, what does it do? What's its purpose? You know, like you guys, when I first was exposed to kinesio taping, I was kind of skeptical. I would think, how does one piece of tape really affect an athlete or the tissue in that specific area all that much, right? So what I want to do is, threw me off there. Sorry about that. So the Rock Tape, you know, again, it's all about how you apply it, okay? So what we're going to do with Vaughn today is try to create an optimal healing environment. So I've already gone ahead and done the work, but what I've done is I've cut a couple of these. We're going to use the Moo Cow pattern, but we cut a couple of these fan strips. So really what I'm looking to do is kind of lift that skin, add some separation between the skin and that superficial fascial layer, right? That's where a lot of fluid dynamics happen. So basically what I'm going to do is just kind of create an environment where more blood can kind of get to this area, take care of this injury, aid his lymphatic draining, right? Drainage. Our lymphatic vessels are very brittle. They're very small. You know, think about wet angel hair pasta. That's what kind of our lymphatic system is like. So anything that we can do to kind of keep those vessels unclogged and working in the right direction is great. And Rock Tape is one of those really great things. So what I'm going to do first is prep him. Obviously, I just put lotion on him, so I got to clean him off, right? So this is just rubbing alcohol in a spray bottle. I'm just going to spray him off. Okay, took a little longer than I wanted to. I'm just going to wipe this clean and dry, okay? I like rubbing alcohol because it dries very quickly. And I'm just cleaning all the oils off of his skin, okay? The oils will prevent the adhesive from sticking. So obviously we want a nice, clean, dry surface, okay? Okay, perfect. All right, Vaughn, I'm going to ask you to go ahead and flip over for me. Lay on your back. Away. All right, bud. Okay, just bend this knee for me. Okay, again, we're going to tuck this towel in just so we're not getting anything on the shorts here. Alright guys, I'm about to break one of the first rules I just told you. I'm going to ask him to put this hamstring on a slight stretch just for the purposes of applying this tape, but that's it, okay? It's not going to be a heavy stretch on you, paying attention? All right, so what we're going to do is keep this knee flexed. I'm just going to give him a little bit of a strap. He's going to raise this leg up. Okay, hold on to that. I want you to feel a very, very light stretch. How's that right there? Good? Okay, just hold that position. So the reason I'm doing this is because in an ideal situation when we apply this Rock Tape, we want to have really the skin or the tissue underneath there on a little bit of stretch. Because what I'm going to do now is with very, very little tension, I'm going to apply this tape so that it kind of, when he's in a relaxed position, it lifts. It gives us that lifting action of lifting the skin away from the tissue underneath, okay? So I'm prepping this tape. I'm just breaking these little tabs off. Okay, I'm going to lay this anchor down first. Try to touch the tape as little as possible, okay? And I'm actually going to apply this first strip, the anchor, down kind of right where his lymphatic, where his lymph nodes are in his groin, okay? Because I want to pull any fluid or blood that may be draining out from that injury site. I want to pull it towards that lymph node, okay? You comfortable right there, Vaughn? Okay, and one at a time, what I'm going to do with these little tabs is just kind of lay it on right off the backing, okay? Okay, one, maybe with an inch of separation in between. Again, you use the tape to its full advantage. Try to cover as much area as you can, okay? You can see here is I'm just laying the tape on off the backing. So this tape comes with about 25% tension already on the backing, so that's all I'm going to put on. Again, I don't want a lot of stretch here for the purposes of this particular tape job. Okay, so now I got one on. It's an acrylic-based adhesive, so I'm just going to kind of rub gently on here, create a little bit of heat just to help that adhesive bind down to the skin. We're going to let this tape set for about 20 minutes, and then he can shower with it on. It'll stay probably 3 to 5 days, maybe even as long as a week. Okay. For strip number 2, I'm just going to kind of create that kind of fan action where I'm going to go across the other side. So again, we're going to do repeat the same steps. I'm peeling that end off. I'm going to apply it very proximal on his hip. Kind of come across the opposite side here. Okay. With a little bit of practice, you can get it to kind of look pretty cool, but again, we're not really going for aesthetics, we're going for function here. This type of tape job is great for strains, sprains, contusions, those types of injuries. In fact, I had a men's soccer player when I worked at George Washington University who had a bad quad contusion. I applied this tape job to him, and in about 2 days, the bruising actually started to surface. But when I peeled the tape off, everywhere underneath the tape, there was no bruising. Okay, so that's very telling about the action, the power that this kind of tape has when it's applied correctly and in the right circumstance. Okay, so again, I'm just rubbing this, create some heat, okay? Take that away, all right? So we're not done yet. There's one more thing. Okay, Vaughn, you can go ahead and just let this down now, okay? I'll take that strap away. One more thing that we're going to do here is I'm actually going to throw him on the Marc Pro. Now, the Marc Pro guys will tell you that it's a muscle conditioning device and that it's only used for muscle conditioning and recovery. And that's the way they market it, which is great. But the way I like to use it is that recovery action is the same in an injured athlete as it is in a healthy athlete. So what I'm going to do is I'm going to elevate Vaughn's legs, okay? With this table here, you can use a wedge or pillows, whatever you want to use. Okay, so this is his second skin treatment that we're going to do. I'm going to put a little bit of a pad under his knee just to keep his knee flexed slightly. Just like that. Okay, relax. What I'm going to do is I'm going to get his calf, right, and his quad activating, okay? So not the hamstring specifically, but kind of those muscle groups around the hamstring. Because really what I'm trying to do now is I'm creating that pump. So like we talked about in our last Periscope session, talked about how the Marc Pro creates that pump. So now I'm actually going to show you what I mean by that, okay? So again, I'm not stimulating muscles here, I'm stimulating nerve roots, okay? So I'm grabbing his femoral nerve, I'm grabbing his tibial nerve, and all of the muscles that are attached to those nerves are going to be working for me in this situation. So again, here's our Marc Pro. So one of the leads, we're going to go on the calf. The other lead, we're going to do on the quad. While he's laying here nice and comfortably, right? You don't have any pain in that hamstring right now. We're just going to get this stuff to work, activate for us. So here I am turning the quad up. and you can see I'm only at like 4 out of 9 here, and I'm getting a nice big fast twitch reaction out of this stim unit right here. Okay, so what this is doing now, turn the calf on, I'll explain it to you a little bit more. Okay, perfect. All right, so now what I have going on, right, we talked about last time how your heart as a pump is not strong enough to circulate blood around your body. Well, that's great. It relies on your musculature, right? So I'm providing now the energy to create these muscle contractions, right, and help that venous return, help that lymphatic return. So again, he's recovering in the sense that I am creating a system where I am allowing a lot of blood flow to happen, and blood flow is the name of the game when it comes to any kind of soft tissue healing, okay? So again, if I were to just bury this thing in ice, all I'm doing is slamming on the brakes, okay? I'm slamming on the brakes to that healing process. I'm not allowing him to move on to the repair phase, and that's going to basically ultimately kind of limit his recovery, limit his healing time, okay? So let's just kind of recap as we're wrapping this up. Vaughn, you've been an excellent model, but as a recap, okay, soft tissue injuries, right, obviously get them evaluated first. Don't just kind of never, under any circumstance, just kind of make up your own treatment protocol. Definitely get evaluated by a professional, okay? Vaughn here, we're talking about a grade 1 plus grade 2 hamstring strain, pretty high up. So rule 1, don't stretch it. If it's a new injury, don't stretch it yet, okay? It's already overstretched. We don't want to make things worse by kind of stretching it out even more, okay? Rule number 2, in terms of icing, 24 hours and then stop, okay? So in this type of situation, the only reason we're icing is to prevent further cell damage, further death. We don't need to worry about that too much in this situation. The injury, he's in the inflammatory process. It's there for a reason. So limit your icing to day 1, okay? Rule number 3, you know, again, move to heat within 36 to 48 hours. So we just use the heat pack with microcurrent. Those are 2 very, very effective modalities for starting and stimulating that healing process. So we're going to use those to our advantage at the right time. Microcurrent is not something we're going to do, you know, next week. It's only for that 36 to 48 hour period after this injury has initially happened, okay? In terms of the rock tape, again, it's all about how you apply it, but Rock Tape's got a lot of great resources on their website. Again, www.rocktape.com. Definitely check them out. You can check out some more stuff on our website as well at athleticmovementprotocol.com. Okay, so we're going to wrap this one up. Again, guys, if you're not following us on our social media sites, please, I encourage you to do so. Okay, at Facebook at Athletic Movement Protocol, and on Twitter and Instagram at @amp_athlete. Okay, so all of the notes for today, again, we're going to put them up there. You can watch this video again later on, or share it with your friends. We encourage you to do so. Also, the notes for this will be in the newsletter. So if you're not signed up for our newsletter, please, again, go to athleticmovementprotocol.com. On that main page there's the register for the newsletter. Just toss your email address in there, and I'll send these notes out to you again. Thanks again for visiting with us on Periscope. Hope to do this again a little bit later in the week. Okay, guys, this is Mike from the AMP Recovery Lab signing off.